for the housekeepers, domestic workers, and construction workers, I have with me the Government Gazette, which was issued, which lists a number of sectors who are supposed to be going as from tomorrow, but it's partial, under construction. It lists the civil engineering for public works projects, including water, energy, and sanitation, public works, civil engineering, and construction work, road and bridge projects, including local road repairs, critical maintenance and repairs. So if that construction worker belongs to this, therefore they qualify. But we must emphasize, they must go into sites which have been properly prepared. We need a plan from the employers. We would expect that a number of the employers might spend part of this week doing what is required for them. And then the other aspects talks to the domestic workers, the households. It's here, it's listed, the private households, employment, live-in staff, and I emphasize live-in staff, and staff providing care to the sick, mentally ill, elderly, and people with disabilities and children. They have been included. So if you are a domestic worker living in, you have been covered. The issue of the cost of the PPEs, which is going to put pressure on the workers, on the companies. It's obvious that all sectors, it has happened to government. We have to go extra in dealing with this particular COVID. It was not planned by anybody. Indeed, it's going to be adding more costs to the businesses, like it has done to everybody, to government departments and so on. Everybody has just, unfortunately, to go an extra mile. Now it's a question of a choice here. A choice of going extra, which is, of course, more expensive, or a choice of putting the lives of the people at risk. If you want to operate, you need to understand. You need to understand, and it's happening all over the world, that all of us will have to go an extra mile. The only plans which we are having for some of the businesses who might be struggling, it's in terms of tariffs, but we are going to be able to deal with that once we start normalizing the issues where they will have to apply, because tariffs is not just meant for the employees. If they have plans about their businesses to turn them around and they are going down, they will have to apply to the UIF, because there's a part which deals with that. The Mercedes percent, our role is very simple. We're demanding all the employers to comply, both public and private. I know in some areas the police have been reduced for the same reason of social distancing. Instead of having 2 or 3, they are having 1. We would expect, therefore, that the department is going to be sensitive to that particular issue. Otherwise, they will be violating. Of course, it's a matter which we will also raise, because you've given us examples. And everybody must have the sanitizers. And you talked about some security who do not have sanitizers, who do not have the necessary. It means those employers are violating. As early as tomorrow now, we will get even more details from you. We are going to be sending our inspectors to that particular area you are talking about. Ezinyanda izibamba ngakakuhle uteacher. Sorry. Oh. It's clear what I was saying. What is expected if there are positive workers? They must be transported appropriately. Transported to either to the hospitals or areas of isolation. They are not going to be, they can't just be transported in public transport. Otherwise, even those employers are violating, but we have even said to hide such employers. It therefore means you're violating, in fact, it's a criminal offense. That's what we are saying. So we expect the employers to act responsibly, to act sensitively when they are dealing with those cases. I think the issue of the public transport, I suspect it's a matter which must be raised with the Minister of Transport, but I understand even there that there is an issue of social distancing, there is an issue of the sanitizers before anyone gets into either a taxi or whatever transport, and the fact that they have to take only 70%, it is meant for that. But once they are at the work situation, they become the responsibility of the employer. Oh, yes. Thank you. I had it on my page too. The issue of the foreigners. There are those foreigners who are here legally, who have been properly documented, who are working. There has been a problem of them because of their details, and in particular the issue of the bank accounts. We have dealt with that particular matter, and I would ask after this, after the inspector, the chief inspector, that the advocate Yawa just come and explain that. But the crux of the matter is that we have interacted with the SARS, and they've given us a solution. And but advocate Yawa will talk about the numbers, because I don't carry those numbers. That those who are documented would be able to, in fact, we have found a solution of paying them. Those who are not documented, who are illegal, it's very clear that we can't do something illegal ourselves. That's very clear. Because first of all, they are not legally employed. And how will we know them? Because the employers are also covering those people. They are not claiming for those people. We don't have the records. We only find them when we do the inspections in the different workplaces. So the employers who do not comply, our inspectors, that's why we are requesting that the unions, the individual workers must also work with us and give us this information, so that we're able to use that information we're able to visit through our inspectors those workplaces. But if they are not complying, it means they are in violation, and some are committing criminal acts. So we will have to deal them according to that. Those who have lost the jobs, sometimes even for 3 months, they do not know what's going to happen. We guess that responsible employers are going to have applied for them. If they have not applied, we've opened now the channel of dealing with the individual workers, which we are doing it electronically. We are able to do that, but we have also created the drop boxes in all our labor centers, where people come and drop their applications there, and we try and process them. So, and we had planned for a period of 3 months in terms of our calculations to be able to pay this COVID-19 TERS benefit. So we're still ready to do that. As things go on, we're doing an assessment and so on, we'll be able to say whether we could be able to increase the period beyond the 6 months. We're not sure, but we are going to rely on the calculations by our actuaries. But we must remember that it doesn't mean that we would have that money forever and ever. At some stage, we might hit a crisis, and we might even be forced to reduce the benefit, depending on what is happening.